Well, welcome again to our Wednesday morning 9:45 to 10:15 Ask the Doctor questions. I'm Dr. Ellithorpe from Tustin Longevity Center. We're standard trained allopathic physicians here. There's 5 of us healthcare providers and an entire staff. And we're here to blend the best of Western standard allopathic medicine with the blessings of the older Eastern and natural medicines, functional medicine. And so we are doing these videos once a week to try and show to patients another avenue, you might say, to be able to ask us some general questions. This is not meant to be specific personal medical advice, but rather to look at the type of questions people have. There's so much information on the internet, so we thought it might be good to have real live physicians just with a lot of experience. 40 years. Dr. Merrick has been practicing at least 30-40 years. Dr. Mitchell maybe 30 years. Dr. Kaur the past 6 years, and P.A. Patel the past 2 years. So we've been handling a lot of questions with the explosion of the alternative medicine and how it works into standard of care, and we just think we need a venue like this. So I'll do my best to try and answer your questions. Again, this is right off the cuff, just as if you were asking me personally, walking down the street and catching me. So Talon's not here today. He normally runs the show. Blake is in the background there. Hi, Blake.
Hello.
And he will be sending me the questions. There's a chat on the side here. You can type in a question. We missed a couple last week, so we're going to catch up with those, and then we'll start taking the newer ones. So I'm ready, Blake.
Okay, so from last week, I don't believe we got to at the very end. Michelle says, my 81-year-old mother had a J&J vaccine. I have her taking Energy Core, that's TLC's Energy Core, vitamin C, vitamin D with K2 10,000. With news about the J&J vaccine, is there anything else you would recommend I give her?
Well, the concern with the J&J vaccine and the others as well is this propensity toward clotting and thrombocytopenia, lack of platelets. And there actually, I just have another article. Johnson & Johnson reveals 2 more blood clot cases in the vaccine recipients. This was April 14th, 7 days ago. And that's in addition to the 6 that caused them to pause the vaccine. And so if that's the case, then you need to do things that help your blood flow smoothly. So the number one medicine you'll see us ask here is, are you drinking enough water every day? Water, half your weight in ounces as pounds. So if you're 200 pounds, 100 ounces a day. If you're 150 pounds, 75 ounces a day. So you need to keep your fluids moving. So water's number one. Number 2, as we age, we lose our systemic enzymes. We don't make as many proteolytic enzymes. And these enzymes disinflame us and remove debris in our body. And they also help to keep the flow dynamics and debris that's in the blood vessels. So systemic enzymes, such as we have Vitalzyme here, Vascuzyme, Proteozyme, taken on an empty stomach, because you take these not to help you digest food. You are taking these every morning on an empty stomach to help you to disinflame your body, keep your blood flow moving along nicely. How many enzymes? I would probably take 4 in the morning and 4 in the bedtime, before bedtime, when your stomach is empty, and that's a great protective factor. Plus you'll feel better. I'm getting near to 70 years old, and I just have really no joint problems or issues or aches. I take 6 systemic enzymes every morning, and I always drink half my weight in water as ounces every day. The other thing is you have to stop putting foods in that are high sugar, high carbohydrate, even complex good carbohydrates, when you have more sugar in your body, that is a stickiness. We do a hemoglobin A1C where the glucose sticks to the protein hemoglobin, and that shows your average amount of blood sugar. So if you have a high hemoglobin A1C, it's showing that you have a high consumption on the average of too many carbohydrates, whether good or bad, every single day of your life. Now, the standard in the lab says 5.7 hemoglobin A1C to be normal under that. Now, we disagree with that number. We say 5.2 or less because we find that we have such a lower incidence of all chronic disease, and I had no problems with any of my patients with COVID over this past year and plus some months. So we've done very well, all our patients, and I have a large so you have to drink your water, take systemic enzymes, and drink plenty of water. That'd go a long way to help anyone who has a concern about these vaccines. And
with early primate progressive aphasia and was told there was no treatment or cure. Do you have any suggestions to where to find a doctor or treatment protocol that could help her?
Well, of course, progressive aphasia means the ability of you to speak is diminishing. Does that have a dementia component to it where the patient is just not connected to the environment and not socializing and discussing things? Is this a neurological problem where the nerves to the phonation ability of the human to make sounds and talk? So the myelin sheath, the lining that covers every nerve, is an insulation for that electrical signal to the muscle to do its job. That myelin sheath is made of sphingomyelin, which is a phospholipid, a very special choline-based fat. These fats have been ruined largely in our American westernized eating, the sad American diet, through our eating processed foods, through our eating a high carbohydrate diet, because there's no fats in the carbohydrates. We are made of fat and protein. This is all fat and protein in my hand right here. There's no fruits and vegetables. And if we don't eat those items that give us choline, the basic substructure biochemically for making sphingomyelin to protect the conduction of that nerve information, then what will happen is that nerve will have a breach in the insulation, and there'll be a short circuit, and the function of the muscle command will fail. So one of the things we do here at the clinic is we talk about the good fats and the importance of fat, and to try and diminish all that hydrogenated trans fatty acid corrupting foods and get back to a whole food natural eating protocol that includes egg yolks and meats and fish and poultry with the skin on it and pork. These are rich in all the fats that our body needs, and so we emphasize that. And to help my patients also that are so to say raised on a philosophy to be fearful of saturated fats, and this a sphingomyelin would not be technically a saturated fat. It's a very specialized type of a fat. But these saturated fats they've avoided, so to help them start eating a healthier covering to the cell membrane, myelin sheath for the nerves, we developed, and I had to develop this because they weren't eating it enough, I created the Doctor's Nutrition Bar. The Doctor's Nutrition Bar is a composite of rich phospholipids that help line the lining of every cell membrane in your gut to help with gut health, to stop leaky gut, to help the smoothness of your skin. I have been often told in the course of the years, just incidentally, my father was on the fatty acid research team at Armor Food Sciences, so I grew up learning fatty acid science, and the last gift my father gave me before he died was a book called Good Fats, Bad Fats. So we're up on the knowledge of fats here. And so we created the Doctor's Nutrition Bar to put those very special fats that cover the cell membranes, the lining of your gut, every membrane in your body, to help even the lining of the sphingomyelin sheaths on your nerves. And it's chock full of this wonderful fat. So I would certainly use that. It's very low carb. We did the testing on it where the people who were in the test, we tested their blood sugar before they ate a Doctor's Nutrition Bar, and then we tested them an hour afterwards, compared to the common favorite protein alleged rich bars, healthy bars. And ours were so much lower in the blood sugar and so much lower in the insulin stimulation. So that would be something to look for. I would look for an integrative approach. Find a doctor like ourselves who would help this person with this progressive aphasia, and get a neurologist and a neurosurgeon involved, and consult with them, and all together a program with lifestyle along with the guidance of the specialist should give a better outcome.
Great, and we got another question in email. They're saying they have an eye twitch and they're noticing floaters in both eyes. They're wondering if that could be a concern about an underlying issue.
Well, floaters show up as a aging sign. All of us get floaters over time, and that has happened in me as well, very, very minimally. And when it happened, I went on a fast for about 7 days. I didn't eat anything. I just drank water, and I took high doses of my proteolytic enzymes, my Vitalzyme. I took 5 twice a day, and that dramatically reduced my floaters. Floaters are little bits of protein that kind of stick together, and again, that's a sign that we're low in enzymes, low in our water, too high in our blood sugars, and our body gets dirty inside, you might say, and sticky. So floaters are common. They are not serious, and they can improve. I made mine improve dramatically just by fasting. Now I'm on a carnivore diet, and it has continued to improve. The other thing is, I think that person asked about Premarin being given to her.
I'm sorry, say again?
Didn't that email also have a question about getting Premarin vaginally?
Right, and they're saying that they're getting bloating and pelvic discomfort as well as itching.
All right, so the carrier mechanism for delivering estradiol in a cream, you might be reacting to the carrier mechanism because the lining of the vaginal canal is also thinning and aging as well. As it gets thinner, just like as we get old, we get thin skin and our capillaries can break and we get bruising. And when you get to your 80s and 90s, you often see permanent kind of bruising on the older patient's arms. So the same thing is happening vaginally. So giving you estradiol helps improve the lining of the vagina so that you were given probably Premarin vaginally, but you might be reacting to the carrier mechanism. Or it could just be that you're so thin, anything would make you sensitive. And if it's tolerable, I would continue using the Premarin vaginal cream. You might ask the doctor to compound something in as simple a carrier as possible. They can call up their compounding pharmacist, talk with the pharmacist and say, my patient is having more itching with the Premarin. Is there any more gentle carrier cream that we could mix estradiol in to help her? So a integrative doctor will go to that extra effort for you to call a compounder, discuss these things. The bloating could be just a impact of the reintroduction of estradiol and the body being, so to say, turned on. As we get our hormones, which are reconstructive and rebuilding in our body, there's a lot of debris, just like any remodeling in a home. It's messy for a while. So these could all be explained away as minor side effect phenomena. Again, more water, more enzymes will help this. A low carb diet will help this. Building up the cell membrane, eating a Doctor's Nutrition Bar or foods that are rich in phospholipids like chicken with the skin on it, grass-fed beef, wild salmon, and pork that is grass-fed. All these are rich sources to help the resiliency of your cell membranes, and that should help you. Next.
Great. Yeah, we got a couple new questions in online. The first one is Jennifer says, I've begun taking systemic enzymes. I take them in the morning and the evening. Is there any reason why I can't take them all in the morning? Is there a benefit for taking them twice, AM and PM?
Well, again, we are not funded. Doctors like ourselves are not given money, and the NIH and these big influencers, we've become such a corporately controlled system. We need money to give you exact answers because I like science. So I have to use clinical logic. It makes sense first thing in the morning on an empty stomach, about an hour before you eat, to take these enzymes so they're brought into the system, absorbed, and you get use of them before you would eat. And we, in general, ask people to skip breakfast, to do intermittent fasting, to narrow the window of time that you're eating every day. That's another healthy thing to do. Taking them at night also might give a broader perspective for your body to cleanse itself. So at night, if you stop eating at 6 o'clock in the evening, by the time you go to bed at 9 or 10, your stomach is empty, and it's at night that we do all our reconstruction and building and healing. So if you wanted to get rid of a floater, or you want to have healthier looking skin or less joint pain, you're going to want to take enzymes at night when the body is trying to have that time to clear out. Think of the enzymes as soap suds for the body, and then you take it while your body's cleaning and rebuilding at night, so you wake up more refreshed. So I do think there's wisdom in doing it in a split dose.
Great. And I'll say personally, I sleep better when I take them before bed.
You also sleep better, yeah.
Another one, Amela, says, I'm taking Armour Thyroid for the last 4 years, and lately my hair has begun falling out. Could this be the reason? Blood work looks good. What might help?
Typically, Americans are not eating enough protein, and protein is what your hair and your nails are made of. I would want to look at your total protein in a chemistry as well as your blood urea nitrogen levels. I find that people who really increase their protein intake, remember, this isn't like some pharmaceutical drug where you take something and the next day your blood pressure is better, or you have a pain relief immediately. Remember, when we're building our body, it takes time. It takes 9 months to make a baby. It takes time to grow hair and nails. So if you eat a consistently higher, rich quality protein, you will see your hair improve. I do not think it's related to the Armour at all. But again, I don't know you. You would have to see me. I would have to look at you, look at other factors, look at your blood sugars. Because what will choke your hair? High blood sugar. And what does the standard doctor think is acceptable for a blood sugar? They'll let your blood sugars go up to 100, some labs even to 115, and call you normal. I call you a pre-diabetic at that point. So if your blood sugar, when it's fasting, when you wake up in the morning after a 12-hour fast and your blood sugar is above 85, then you're overdoing it with carbs, and that's going to eventually diminish the circulation to your scalp and the non-critical parts of your body, and you'll start seeing your skin wither, your hair quality diminish, your toenails will stop growing as well, you might start getting fungal infections there, and so forth. So protein deficiency is the number one, and lack of digestion of that protein. So we use Perfect Aminos here. This is a researched, physician-designed amino acid to jumpstart your protein production, to help with muscle formation, resist the muscle loss that we experience as we age. After age 40, you start losing about 0.5 muscle mass per year on the average, and then past 60, you're losing about 1% of your muscle mass. You can help prevent that with a richer protein diet with high quality grass-fed beef and wild fish and so forth, wild poultry. And then we have the Perfect Aminos that help with that as well.
Great. And then following up on that protein, the next question is, what is a carnivore diet?
A carnivore diet is where you're only eating meat. In other words, there's not one bit of plant food at all in your body, not one bit. And so this has become more discussed in the news lately. And I, as a physician, want to understand what my patients are reading and seeing. So I'm often looking at these commercials that I see my patient would have watched. And the ones on the carnivore are becoming more and more often. So I decided to do this diet so that I can understand from a ground level, a personal level, what they're going through. So it's eating meat, and it's eating fish, and it's eating chicken, and it's eating shrimps and scallops and lobster and crab, and just animal products. They say nose to tail. Liver, I eat liver with it. It's very good. When you're doing that day after day after day, it's extremely satiating. You're not hungry when you're on this total diet where you're just having a lunch with a steak. Typically, I'm eating, on the average, most often with my busy day, I'll just cook up a ribeye or a New York strip steak, and I eat a steak twice a day now. I'm not hungry because all those rich fats that are helping rebuild my body, my blood sugar is very, very low. I urine dipstick myself every day. I'm always in ketosis in the moderate zone. And I think since starting the carnivore diet about 10 days ago, I've lost 10 pounds. So I was happy with that. So I'm a very, very allergic person. My blood type is B positive. Being a B positive and that class of people, we tend to have a lot more allergies. And since it's the allergy season, I thought what better time to do what we call a restricted diet or an elimination diet. And the most significant and powerful elimination diet is the carnivore diet, where you just eat one thing, which would be the beef or chicken or fish. And I'm sticking with beef simply because I don't want any other biochemical data going into my body to see if my sneezing, my allergies, my runny nose has improved. So that's what a carnivore diet is.
Great. And that's all the questions, and we have about 5 minutes left if you want to cover some other items.
Well, I have about 20 articles laid out. Every week I have many, many articles. And one of the most interesting things you might have already heard, this is now 2 days old, Stanford here in California came out with another wonderful study about face masks in the COVID-19 era, a health hypothesis. So this study right here is published, just came out about 2 days ago in the news. And so I read the article, and in the back, I want to read to you a statement there. The existing scientific evidence challenges the safety and efficacy of wearing face masks as preventative intervention for COVID-19. The data suggests that both medical and non-medical face masks are ineffective to block human-to-human transmission of viral and infectious disease such as SARS-CoV-2 and COVID-19. Supporting against the usage of face masks, wearing face masks has been demonstrated to have substantial adverse physiological and psychological effects. These include hypoxia, hypercapnia, shortness of breath, increased acidity and toxicity, activation of fear and stress response, rise in stress hormones, immunosuppression, fatigue, headaches, decline in cognitive function, performance, predisposition for viral and infectious disease illnesses, chronic stress, anxiety, depression. Long-term consequences of wearing face masks can cause health deterioration, developing and progression of chronic disease, and premature death. So I have just been practicing medicine 40 years. And in 40 years, never did I abandon Koch's principle, which is research-based data identifying how to look and sequester and identify a disease process. That is, you take a person with a symptom, you culture the suspected fluids, the mucus, lung washings, sputum, and then you culture it and you look for what might be different or new there. And when you think you've isolated it, then you take that isolate of the fungi or bacteria or virus, and then you take animals and you infect them with it to see if they get the same symptoms the humans did. And if they do, then those animals themselves have to generate sputum or a discharge that is cultured that is identical to what was in the original human sample. That's following Koch's principles. I mean, I was trained in the 1970s in medicine, and so I've been through all the viral illnesses, all the alleged pandemics, and I have never seen the healthy quarantined and asked to put on face masks. Never. You only ask someone to stay home if they're ill from work. If you're feeling ill, you have a low-grade temperature, please don't come to work or to go to school. Don't go to church. Don't attend activities until you're well. And if you're not improving, then you see your doctor. The healthy, those that are healthy, are never sequestered or asked to put on a face mask. So in 40 years, I've never brought harm to anyone through these practices, and all my patients here at Tustin Longevity did very well. I have a large senior population, a population that has cancer, diabetes, obesity, hypertension, and many other autoimmune illnesses, and they all did very, very well. So I'm aware of many, many historical face mask studies. I've done other videos on this, and we have consistently found that these face masks have failed us. They're not to be relied on, and we're not designed to try and stop a viral particle. You got to remember the face mask material itself can create allergic reactions, has debris, and you might be breathing these in. These are synthetic, and the spaces in the mask are big enough to let the size of a COVID particle viron, which is like 1 micron, and the smallest they can get these masks, the N95, is like 3 microns in prescription. So we've known, those of us who are mature older doctors, we have seen this, and we probably cumulatively are just baffled at the behaviors that we're seeing played out. How much time do we have?
We have about 1 to 2 minutes left.
So you might want to look at that. This was published in what's the name of this publisher article? Elsevier, Elsevier, and the author that was in charge of this was Baruch, Baruch, and the last name is Vainshelboim, Vainshelboim, and the publication date on this is date is this? October 28, 2020 that I read from, okay? All right, now the other thing is I wanted to point out, I thought this was kind of amusing that there was a publication April 13th, 2021 by Nancy Melville, Melville, in medscape.com, and she published an article that this recommendation is don't screen for vitamin D in the general population, says the United States Task Force. And the United States Preventive Services Task Force has revisited the issue, stating that 7 years after concluding that evidence was insufficient to recommend screening for vitamin D deficiency in the general population, the USPTSF has revisited the issue and come up with the same conclusion. And they say the current evidence is inadequate to determine whether screening for and treatment of asymptomatic low vitamin D levels improve clinical outcomes in community-dwelling adults. This was in JAMA, published April 13th. I think that's sad because there's a volume of research that says it improves. And how do you explain how our thousands of patients here did very, very well. We've always, for decades, checked their vitamin D levels, and we have given them vitamin D. So it's a sad thing. Maybe next week I'll talk about some of my concerns, maybe for a tantalization to excite you. You might go to an article written by Carrie Gillam, Gillam. Her first name is Carrie, Carey, and she's a journalist who published this October 17th, 2016, and this is an article discussing the Spider papers. If you haven't heard of the Spider papers, they stand for the Scientists Preserving Integrity, Diligence, and Ethics in Research. Scientists Preserving Integrity, Diligence, and Ethics in Research from the CDC. And I went and I got the original paper. And so this is the original paper right here. And here these scientists wrote this to their superiors and to members of the United States Congress, talking about corruption in the CDC. So Carrie Gillam, contributor, December 6, 2017. December 6, 2017. Look up CDC whistleblower Spider, okay? CDC whistleblower Spider. And you can read her article. She does a nice summary of it and the impact of it. I have the original article. You can find that in research if you look up. This was addressed to Carmen S. Villar, Villar, MSW is the title, Chief of Staff, Office of the Director, MSD-14, Centers for Disease Control and Prevention, Atlanta, Georgia. And they addressed, Dear Ms. Villar, and they signed respectfully, because it was a large group of scientists at the CDC back then, identified as Spider, because if they let them their names be known, they would be fired. So that's what you have to do when you are concerned that there's corruption there. And could corruption possibly be why they came to the conclusion that you don't need to screen for vitamin D? I mean, I'm trying to look for informed consent for my patients and the best thing for my patients, so I'm studying all the time. Medical school didn't stop for me in the 1970s. Medical school is every week of my life I'm doing research on behalf of my patients, and I have to ask questions. I'm not saying I have all the answers or that everything is absolutely 100% true. I am just saying there's too many disturbing articles from qualified physicians who are writing about this, and we need to listen to them. We should not censor them. So we should at least look and see and have an open mind. And with that, I'll say thank you. Have a blessed week. God bless, and I'll see you next week, Wednesday, 9:45 a.m. Take care.
Perfect.